is Cancer Control Month, a time to raise awareness for cancer prevention, early detection of cancer, and cancer treatment. Baptist Health System provides accredited cancer care to the San Antonio community. And joining us now to tell us more is Dr. Morton Kallenberg, Medical Director of Cancer Services. Welcome, welcome, Doctor.
Very much, appreciate it.
So let's talk about the importance of Cancer Control Month.
Well, Cancer Control Month is an opportunity to make individuals aware that cancer prevention and early cancer treatment are fundamental to the success of patient health. If we can prevent cancers from ever occurring, obviously outcomes are going to be a lot better than if somebody presents to their physician with a later, more advanced cancer. So this is an opportunity to let patients or individuals in the community know about opportunities. We have data-driven schedules, testing that's available. So let's take breast cancer, for example. Annual mammography, self-breast examinations can detect lesions that are several steps away from ever becoming cancer that, when treated, can prevent cancer. And the same thing with colonoscopies. We have appropriate scheduling based upon age or risk. And if a polyp is found and removed, that polyp can never, ever become cancer.
And so, of course, as you've been touching on, early detection is key, right, for treatment?
Absolutely. So while we want to prevent, we also understand the reality that we're not going to prevent all cancers. I mean, that's an obvious statement to everybody outside or inside the medical community. So if we can detect any form of cancer early, that allows treatments to be more successful. And that's part of the awareness campaign for this month, that early detection absolutely is one of the keys to cure. So it's important for individuals to understand that, listen to primary care doctor or OBGYN or others' advice, and really adhere to the screening tests that are available for individuals.
So, doctor, what advice would you give to a patient who's just received a cancer diagnosis?
Well, obviously, it goes without saying that for anybody who hears that news, the anxiety level is incredibly high. And I've learned over 28 years of practice that information is the single most important thing to reduce that anxiety. And as part of the information delivery, needs to really include who patients should see and what they should do. So we have, for example, in the Baptist Health System, developed a system whereby a nurse navigator often serves as a first responder for patients who are then paired up with skilled oncology physicians, whether surgery like myself or medical oncology, radiation oncology. Often takes a team to treat patients, but having individuals in your corner who have basically dedicated their practices to preventing and treating cancer is the real important secret to success. And I would say to patients, while the anxiety level is high, be proactive and speak to your physician and pursue care with recognized experts that we have in our community. It's really, really important for your outcome.
Dr. Morton Kallenberg, thank you so much for all that information. For more on cancer care at Baptist Health System, just visit the website baptisthealthsystem.com/community cancer care.